Are you expecting a child? You're at a very exciting and stressful period of planning and preparation and symptoms. Physically, you're going through a lot while your kid grows and develops. Couvade syndrome, also known as sympathy pregnancy or pregnant dad syndrome, is a condition in which the partners of pregnant women, males, frequently suffer the same, or comparable pregnancy symptoms. This condition, however, has not been recognized as a medical or psychiatric disorder. Doubting the dads. Some people have questioned the validity of the Couvade condition. These critics argue that the weight increase that the father may suffer is due to the mother's eating habits, nerves, or other changes that pregnancy causes in one's life. What about the vomiting? Of course, anxieties are also responsible for this. What do the fathers think about this? They're at a loss for words when it comes to vomiting, weight increase, and changes in sexual appetite. How do you tell everyone at work that you need to lie down because you're unwell in the morning? And of course, if they could, they would stop vomiting. What causes Couvade syndrome? Though there are numerous ideas regarding how Couvade syndrome develops, scientists are still puzzled as to why it affects some men but not others. These theories include changes in hormone levels. As the syndrome progresses, prolactin and estrogen levels rise throughout the first and third trimesters of pregnancy, while testosterone and the stress hormone cortisol fall. Feelings of attachment. Fathers who are more involved in their unborn child's development are more vulnerable to the condition. Physiological causes. It is thought that males who are more sympathetic, caring, acquire the condition more frequently than those who are not. In other words, males who sympathize with their partner's pregnancy symptoms or difficulties are more prone to Couvade syndrome. The research on sympathetic pregnancy. This is something that has been investigated and discovered to be true. Certain males are more vulnerable to Couvade than others. For example, if you and your spouse have struggled with infertility or if you were adopted, you may be more prone to Couvade syndrome. There is currently no study being conducted with same-sex partners, but this might change in the future. The truth is that we are unlikely to see much study on this broad issue for a variety of reasons, including the fact that it is not taken seriously by many people. Sometimes the spouses who are experiencing this don't even notice. They assume it's just normal or that it has nothing to do with pregnancy. So, people, know that you are not alone and that the medical community is on your side. Eat some crackers, gently get out of bed, sip some ginger tea, and attempt to get some rest, knowing that birth is just around the corner. Don't allow anybody make fun of you when you claim you're gaining weight, and need to buy some new clothing since you've outgrown your old ones. In reality, all you can do is cure the symptoms with the assistance of your own practitioner. This may be beneficial to certain folks. Many people will feel better as the pregnancy develops, which is usually a pleasant respite at any stage.